So now as we begin, allow me to introduce the theme of this evening's discussion, Rethinking Health Leadership. In today's ever-evolving healthcare landscape, leadership is no longer just about expertise. It's about empathy, adaptability, and innovation. Rethinking health leadership means putting people at the center, embracing technology responsibly, and finding new ways to build healthier, more resilient communities. Each of our panelists brings a powerful lens to this conversation, drawn from their experience on the front line, in policy, in wellness, and in shaping systems that serve better and heal deeper. So, with that, let's begin. Dr. Salvin, how are you today?
I'm doing fine, thank you. How are you?
I am perfectly fine. Don't ask. So, Dr. Salvin is a globally recognized metaphysician and spiritual wellness pioneer with decades of experience blending in public health and holistic healing. Dr. Salvin will shed light on the rise of spiritual wellness in 2025 from niche to mainstream.
Thank you very much. I am Dr. Linda Salvin, and welcome everybody to the Forttuna 2025 here in India. I won an award in Dubai last year out of 880,000 people. I was in the top 200. So those of you that are here are special and know that because this is going to change your life. As far as what's going on the spiritual landscape in love business, I'm an independent solo practitioner. The maximum employees I've ever had personally were only 5, but I've generated my own career brand, and I network with people in corporations, hospitals, doctors. I've worked with people who are homeless all the way to the White House, and I did it on my own, a day at a time. Just you'll hear me as the keynote, but it all started in epidemiology. So I worked for government. I did cancer research. I did health education with AIDS, STDs. I did industrial hygiene for an aerospace company. I did all the corporate work when I was young, out of college in 1977. I got my master's of public health. And then 4 years later, I was in a commercial airline plane crash. And I became very psychic that day. I had an out-of-body experience. It was the first of 3 near-death experiences in the 80s, long before the internet, but Google it. And I had to go figure out what had happened to me. And I became very fragmented, but very psychic, very spiritual. And I followed that versus everything else that was going on. And then dealing with the corporate structure and trying to explain that I'm real spiritual now, but I see this. I've learned in 44 years of tripping and falling and failing and being criticized and being told you can't or you're crazy or whatever. I kept following my God. Whatever that spiritual passion inside me was, I just bolted through all that stuff. And here I am at the age of 71 with a master's in public health. I got my PhD at 54. It's never too late to do anything, but dealing with engineers, CEOs, MDs, DCs, chiropractors, physical therapists, bankers, investors, researchers, writers, because I'm in the media now. And I got into the media radio in 94. I got on TV in 92. I mean, this is not what I studied in epidemiology, which is how to figure out disease statistics. No, I showed up, but I learned to communicate their language. I would play their game, and sometimes I'd say no, and they say no. But when I learned how to balance and understand the structure when I needed certain things from a corporate position to help me with my company's growth, it works. So by becoming more spiritual and listening to who it is I'm either defending myself or breaking down doors or opening new trails and blazing through that, it's always the relationship that's established, regardless of how left brain, corporate, linear, versus some of the airy-fairy, new agey weirdos that I will not deal with today, because you can go through the whole spectrum. But again, it's the balance of integration today in 2025, we are seeing the growth of the holistic movement. We are seeing the spiritual movement. We are seeing more and more nutritional movements. We're seeing more healthy movements because it's caught on. It started probably in the late 60s with the hippies. Oh, let's eat grains and let's, be healthy. But not everybody follows that. You take yourself, you take the spiritual aspects into a very cognitive world with the right person. You're going to break through, make an impression. And even though I don't think I'd ever hear back from somebody, that phone call comes through. Oh, yes, I do understand. Yes, I do want to be a part. Oh, yes, I will help you. It's the evolution. We are living in some of the most spiritually challenging times the planet's ever seen. And we're evolving quicker ever since lockdown, which I believe was the start with the change with the lockdown. It also propelled us spiritually, and now we're moving faster than ever. My suggestion to you is grab on and don't let go, and always stay true to yourself. And if you got to knock down those doors, there's a God, something with a higher purpose leading you to it, and they'll see it through it. And if it doesn't work, the next door will open. Just keep going.
Thank you, Dr. Salvin, for bridging science and spirit so seamlessly. Your voice is a reminder that healing is both internal and collective. Thank you so much. Now, we'll join in welcoming Dr. Joseph, a frontline hero who managed over 600 COVID patients during the height of pandemic. With a wealth of hands-on experience and deep clinical insight, he will talk about lessons from the front lines, crisis leadership in healthcare during a pandemic.
Thank you, Aditii, for those warm words. Yes, truly, the pandemic was a game changer for the entire global community and the medical community. We had never faced anything like that before. We had not studied about the virus in our textbooks also, so it was a totally new ballgame. I was with the VPS Lakeshore Hospital in Cochin during that time, and the brief was somehow to identify the cases correctly and to make sure it doesn't spread to others. That was the initial brief. Later on, we discovered that it was not so simple also, because the virus keeps mutating and it knows no gender, no religion, no caste. You are exposed to it, you may be infected, you may recover quickly, or you may die. And unfortunately, we did witness quite a few deaths during that time, including young people. So that set the ball rolling to find out what are the comorbidities that could worsen the mortality. And I myself am a diabetologist. Prior to this, I was Economic Times 2022 winner for Best Diabetologist. So for that, I found out that the patients who had high sugars were the most vulnerable patients. They were the ones whose prognosis turned quickly bad within days, or just within 2 or 3 days, they are on the ventilator. So the first thing I did was the patients who were admitted in our team, we made sure the sugars were under control using a combination of insulin and tablets. Of course, we were using steroids in patients who had severe breathing difficulties. And as you all know, steroids themselves cause the surge in sugars. So it was a battle to balance both entities. On one hand, we had to treat the virus. On the other hand, we had to make sure the sugars were under control. So you could say my phone was ringing 24 hours a day. Those were days when we were hardly sleeping. We were wearing the kit. And by the time we finished the rounds, we were drenched in sweat. And I would like to personally thank my mom. Poor thing, she used to wash my laundry, though it was risky for her. But I still, I think I owe whatever I've achieved to my mom. And of course to my wife and dad also. But the leadership the good thing about that was it made each doctor an administrator. It was not like we were just admitting any other case. We had to counsel their relatives who had dozens of questions to us. We had to deal with sad cases where the patient dies and how to break the news to the relatives. It was a new learning curve for us actually, because some of the relatives were like shocked. There were young widows or young spinster, husbands who lost their wives. So how to break the news without, demoralizing them further. Secondly, we had to coordinate with the hospital administration in a big way, because they relied on us to inform what all the hospital has to procure before admitting cases. So I was involved in close discussions with our CEO as to how much PPE kits are required. Later, when the vaccination was made available, who to prioritize. Then getting calls from all over Kerala, because everybody was desperate to get the vaccine first, and we couldn't do it. We had to follow what the central government had made a protocol. So we had to do it in a way that doesn't offend anybody. Later on, we had to field questions from the media about the side effects of each vaccine, because a lot of conspiracy theories were going on that it will cause stroke, it will cause heart attack, and that itself was a big task. Then India finally imported the monoclonal antibodies. Then we had to field questions regarding that. Everybody was asking for that, so we had to explain to whom we can give. We even had to do experimental things like give it to a sick patient. And later the other doctors started, fighting with me, because originally it was meant to be given for stable patients. Luckily, the Oxford University did a recovery trial, and then I could show them evidence how it can be used in sick patients also. It was a famous trial. So the set of challenges, I think, made me not just a better doctor, but to be honest, it made me a better human being and possibly a better administrator. So God forbid if another pandemic arises, be it in India or across the globe, I think that was the biggest learning lesson I got from the original pandemic. And I hope I can use that expertise to my colleagues. Share that knowledge to my colleagues and help my patients. Thank you.
Thank you, Dr. Joseph, for sharing those powerful frontline experiences. Your resilience truly defines what healthcare leadership looks like. Thank you so much. Let's now hear from Dr. Michael Connor, a transformative education leader and the founder and CEO of Agile Evolutionary Group, with a mission to ensure inclusive learning and public health awareness. Dr. Connor will explore equity in access. Can we build a more inclusive global healthcare education system?
Thank you, Aditii. And good evening, everybody. First of all, congratulations. Such an honor for you to win this award. This award will change your life. Just to be a part of 500,000 people applying for this award and be the 135 selected to this, you are very special and continue to impact and influence. And yes, just hearing everybody speaking, one of our first, I like to say, projects that we worked on was we were looking at health education specifically for students and teachers. We saw an increase domestically or back home in the United States with chronic absenteeism, students being sick, especially teachers as well. And this was because of compromised air quality, specifically in the density of high poverty areas. And we took an initiative to try to curtail that using advanced analytics, predictive analytics, as well as real-time data to be able to provide strategic purification. And we partnered with an air purification company where we were looking at specific data, which focused around when are the strategic opportunities for this purification during the academic day. Because our theory of action or our value proposition was that if we improve air quality, A, student cognition will increase, B, students will come to school, and C, our teachers will come to school. More importantly, we wanted to have healthy environments for our students as well, because obviously if we have compromised air quality, that means compromised health environments, which means our students are coming to school and they're not learning. So we did this over a period of 8 months. And we actually curtailed the chronic absenteeism rate by 25% in the 6 districts, 20 schools that we were in. Moreover, we saw an increase in teachers coming to school, obviously, by 35%, and cognition increased by 65%, meaning our students were on task, were focused, all because of one switch, one focus around air quality. So yes, the health of education, the health for our students is critical, especially for our adults that are in the building. And also we just saw just an increase of just wanting to be in the environment, totality of engagement for our teachers and students. And it was just focused on air quality. So we see the importance, right? If we want to improve outcomes, if we want to improve the chances of our students, moreover, preparation for a future that we don't even know, we have to be able to take in consideration the environments that we're in. Our students, when they were matriculating back from the pandemic, was such an arduous transition back, specifically on with regards to how are we going to ensure that the totality of all of our students were addressing their needs. We always say that in education, this is it's a selfless type of industry. It's moreover, we want to put our students first, our families first, over us. And just by that initiative, just to improve the health conditions of our students, it was more satisfying for me because, again, we're trying to reach 3 million students globally, to have this impact on them, but also just to see walking in those environments, knowing that we had better, healthy learning conditions for our students. So yes, it's very important, Aditii, and we have to continue to do that. So thank you for everything that you do. And yes, continue to put education first as well.
Thank you. Thank you, Dr. Corner, for that enlightening perspective. Finally, we have Mr. Subramanyam Yadavalli, a seasoned healthcare leader with over 3 decades of experience driving innovation in patient-centric care. Today, he'll share lessons on building scalable, sustainable healthcare, leadership lessons from a 30-year journey.
Wonderful. Thank you. Thank you, Forttuna Global. This is my second time I am speaking on this forum. First of all, let me first salute my Indian soldiers who are actually fighting 24/7 for all of us. That today, if we are protected and we are here and we are doing this, I think, my deepest salutations goes to them first. Healthcare is something, I've been in healthcare for last 40 years, not just 30 years. Now it is my 40th year. So whatever I have seen in healthcare, and when we started, in fact, Apollo hospitals in India, there was no corporate hospitals that time. There is no modern medicine in that time. It was more state subject. So when we started, there were a lot of challenges. Why we started this? Basically, when our chairman lost one young person at 32 years, for a bypass surgery. In those days, we used to send them to US for, Dr. Dental Cooley, who used to operate this patient. So, but he couldn't go and delayed. He lost the young man. So I said, no, I have to do something in India where the same quality of services, same quality of medical care can be given to my own people in India. So that's the basic philosophy. That's the seed, where he started. He was just a practicing cardiologist. But, now today, if you see, we have about 80 hospitals across in India and few hospitals abroad also. And we have more than 2 lakh people working for our organizations at this point of time. What we realized in healthcare during my journey of 40 years is, your intent to give back is something which is very, very important in healthcare. As long as we know that our intention is to give back to the society, that's the best thing, that's the best learning, we have in life. Equitability and accessibility is something which is very, very important in healthcare. Luckily, today, the technology is helping us, AI is helping us, telemedicine is helping us to give this sort of equitability and accessible healthcare across India, because India is a vast country. We have lots of places where they're inaccessible. You can't have a critical care specialist operating there or, emergency medicine person operating there. So, but the telemedicine, everything is helping all this. So my learning is, once you have that intent, so there are 4 stages, in this 40 years, I have learned 4 things. One is, the first stage is education, you learn first. The second is you practice what you learned. The third is you need to teach, what you learned, what you practice. The fourth is, the most important thing is that giving back to the society. If you don't do that fourth one, then, it is, we will not achieve what we want fundamentally. The fourth one is very, very important because, I believe fundamentally from a leadership perspective, whatever we are now enjoying, whatever we are earning, it is not yours. It is the society's. You are earning from the society. So you better give back, whatever you earn. Once you have this understanding, everything will become equitable. Everything will become accessible. So this is the greatest lesson, at least I have learned in my 40 years of experience. Thank you so much for giving me the opportunity to come here and talk to people. And, celebrating doctors' achievements is celebrating myself. Honestly, in this, I must tell you this, it is, if I am, felicitating doctors, we are felicitating ourselves. There's nothing. Vaidyo Narayano Hari is what our philosophy said. The doctor is nothing but next to the God. Vaidyo Narayano Hari. He is next to the God because he is the person who is actually removing a pain. So what more, I'm among so many healthcare professionals. I feel I'm in a temple now. Thank you so much.
Thank you, Mr. Yadavalli, for distilling 4 decades of experience into such actionable wisdom. And I believe everybody would be so inspired with your leadership. Thank you so much. And with that, we conclude this thought-provoking panel. Thank you to all our incredible speakers for your time, your stories, and your perspectives. Let's give them a big round of applause.